Hi, my name is Dr. Simon Agger, chiropractor and clinical nutritionist. I'm here today to talk to you about alternatives to non-steroidal anti-inflammatory drugs. Some of you are familiar with Advil, Aleve, aspirin, and acetaminophen and Tylenol. And if you're not familiar with some of the side effects and controversies surrounding those, see my video on some alternatives thinking to taking non-steroidal anti-inflammatories and some of the facts out there that you have to weigh up if you're taking them. So today we're going to talk about alternatives to non-steroidal anti-inflammatories. One of the very strong alternative to taking pain pills is chiropractic care. And chiropractic care looks to reduce pain naturally through using the nervous system in the body. And for those of you who are new to chiropractic care and have never experienced that type of pain relief naturally, then I invite you to see one of our videos on reducing pain naturally with chiropractic, and a more in-depth explanation into what happens when we perform a chiropractic adjustment, why the pain goes down, why the function improves, and how all that happens through the nervous system. Very sound science behind that. There's a number of major studies around in major journals documenting the safety and the efficacy of chiropractic. It's very safe. It's far safer than taking Advil, or especially taking aspirin and Tylenol at the same time, or especially Tylenol and any alcohol. It's very much safer than any of those modalities for reducing pain. One of three studies I want to share with you is the evidence-based guidelines for the state of Oregon. Chiropractic is the only recognized modality which is drug-free for the treatment of both acute, subacute, and chronic. That means it's been going on a long time, low back pain. And that's adopted by the state of Oregon here today. First point of call before you do any drugs, before you do any surgical procedures, get adjusted first. That's a very big part of the state's commitment to reducing the burden on the healthcare costs of the state of Oregon and the nation. So other studies that we have includes the big study in spine which was done. And Spine is a major journal focusing on all, not just pain syndromes, but all the latest research around the world involving the spinal column. And when they studied spinal manipulation, they studied it in context with very strong prescription COX-2 inhibitors like Vioxx and Celexa, and also acupuncture, which shows some benefit in reducing pain also. And they took people who had chronic pain for a long period of time. The average patient had pain for between 6 to 8 years of pain. And with the years of chronic pain, they performed 9 weeks of therapy. And they had 4 different groups: a placebo group, a group getting acupuncture, a group taking COX-2 inhibitors like Vioxx or Celexa, and they had a group getting chiropractic adjustments. And staggering results on that for chiropractic. We had, in just a 9-week period, 27% of those patients were completely asymptomatic. That means they had no pain after 8 years of chronic pain, which is incredible. The acupuncture group got about 9% that were asymptomatic after 9 weeks, a full 2/3 less than chiropractic. And the medication got 5% asymptomatic within 9 weeks. And then more significantly, the side effects were 0, the people that suffered an adverse event with chiropractic and indeed acupuncture. But the drug side effects were 6% in there. So a massive difference in efficacy for chiropractic. The third study I wanted to share with you was a federal-based study in '97 where the Agency for healthcare policy and research looked into all the different ways you can reduce pain. And spinal manipulation came out tops, especially for acute pain. That's pain that's just occurred and is very high. Worked very, very well, and they recommended to the federal government and the federal healthcare policies that chiropractic and spinal manipulation should be the first port of call for anybody with acute back pain. So some studies there are showing you some of the alternatives to non-steroidal anti-inflammatories for pain. Other things are herbs and natural anti-inflammatories. We've got omega-3 fatty acids like fish oil. They're essential fatty acids, which means that they can't be made by the body. It means we have to get them from external sources. And they're very strong anti-inflammatory. Most of you know fish oil, cod liver oil. They work very well. You need about 2.7 or more grams a day, and of course it's got to mean that it's a fat, so your gallbladder's got to be working well. You've got to be able to tolerate fats. That's an excellent source to do. It's good, great for the brain, good for the adrenals too, good for the hormonal status of the body. So fish oil is something else that you've got to look at. And then you've got to look at some of the herbs, the boswellic acids and turmeric. Mountains of research on those as anti-inflammatories. They work very well. Also glucosamine sulfate has some efficacy on reducing pain, especially in the extremities for knee, patella pain. Very well researched. In fact, non-steroidal anti-inflammatories actually inhibit baby chondrocytes, so if somebody's doing non-steroidal anti-inflammatories and taking glucosamine, it's kind of, you know, what's going on there. And the same thing with non-steroidal anti-inflammatories and omega-3 fatty acids. They get inhibited too by it, so you have to be careful what you're taking. You have to know what inhibits what and what it does, but very sound evidence on reducing pain with turmeric and boswellic acids too. Anti-inflammatory diets are another way, taking down major inflammatory foods, whether we identify them through muscle testing, laboratory work, or elimination diets. Very common foods such as some wheat products, some milk products. There's lots of literature on those, flaring people up. Some people can get sensitive to soy or eggs also. That's all very well documented. And actual sugar consumption can be very pro-inflammatory too. So looking to look at the diet, scaling down the diet, using some of the anti-inflammatory diets or modified versions of those that we use here in the clinic work very well at taking down pain. Blood sugar regulation, if your blood sugar is all over the place during the day, if it's going up, it's going down, you're frequently craving, you're going to be inflamed. Your cortisol levels, your stress levels is going to be high, and you're going to have more inflammation. So paying attention to blood sugar regulation, getting some feedback on that will also help to reduce inflammation. Finally, identification of any food allergens. People get allergic to different foods. That creates inflammation in the body, inflammation in the gut, inflammation into the rest of the body and the bones and the joints if it's been going on for a long time. And of course, if it's repeat offenders, if we're doing the same thing over and over again and it's having the same effect. So getting those checked out is also a very large area that you can decrease inflammation and stress on the body. Also toxins on the body, immune challenges on the body, all of those things, whether it's chemicals, heavy metals, bacterial, viral challenges, they will also put increased stress on the body, leading to increased inflammation in body systems. If that goes on long enough, it'll bleed over into other systems, and you'll have inflammation in the joints, inflammation in the muscles also. So identifying those, eliminating those can also make a huge difference. And hopefully what you can see, a lot of these natural alternatives to non-steroidal anti-inflammatories involves a very holistic look at the body and a holistic breakdown and looking, okay, what's going on, where is it? And that can make a very big difference. So proper nutrition, proper hydration, feeding the body correctly, identifying any deficits, making that area stronger through whole foods, organic foods if possible, can make a big difference. Using whole food concentrates is something that we do every day here. in the clinic, can also start to feed the body, so it helps to fight the inflammation. The inflammation comes down. Very effective there. And then finally, regular exercise. Increasing the oxygen delivery into the tissues is a natural anti-inflammatory. Why do they give people oxygen when they're inflamed? They want more oxygen, the tissues to heal a little faster. Why do they use oxygen tanks with elite athletes to heal injuries faster? They need more oxygenation. The more oxygen you get, the better you're going to heal. And so people who do a little bit of daily exercise are always going to have less inflammation than those that do. Unless you've got joints that are giving you problems, which need to be assessed through a functional exam for a chiropractic assessment or something like that. Positive thoughts, finally, another way to take down inflammation. We've seen these studies done with weight loss very commonly, where people will go on a diet, there'll be a placebo group, and there'll be other people just visualizing losing weight, very successful in doing that. And positive thoughts through affirmation, meditation, visualization, or prayer also help to feed that positive mindset. So that also helps to take inflammation down too. So a lot of stuff I've covered, but I wanted to make sure that you knew that apart from chiropractic care, apart from diet, exercise, hydrating well, and herbal remedies, natural remedies, there's also many ways that you can identify stresses on the body, whether it's an allergen, whether it's a toxin, whether it's an immune challenge, whether it's a heavy metal or a chemical, which can help to take the inflammation down on the whole organism. And as ever, you've got questions about this, you get excited about this stuff, check our website out, give me a call, happy to help you further. Again, my name is Dr. Simon Agger, and I'm here to help you. Thank you.